As soon as I wake up this computer. Hello everybody and welcome back to Chronic Health, the general wellness chiropractic podcast for Greystone Chiropractic in Birmingham, Alabama. I'm Dr. Lee Goldenberg.
I'm Teresa.
I'm Jessie.
And I'm Hunter.
And we're here to talk about all things chiropractic health and wellness. And several of the things we're going to talk about today are responses to questions we've gotten over the years, and really specifically in the last few months. Since doing this podcast and before that, we do a lot of videos, we share a lot of information through our office, and do a lot of educating our community. And we get a lot of questions. So instead of just answering them one by one, thought we would answer the masses and share that with you guys.
A very special question and answer episode today.
Yes.
Well, I'm going to just go ahead and just start right off here. Looking in at the emails we got in from last week.
We have letters.
Electronic letters.
Electronic mail. Excellent.
That's what I've heard. So we got mail, and it was from Jason from Birmingham. He was asking, are x-rays necessary? And if they are, why?
Why are they necessary? That's a great question. I love that question. I get that sometimes from people who've either been able to go to a chiropractor without x-rays, or they just don't feel like they want to wait to have me look at their x-rays. And why would I care? Like, why would I say, let's look at x-rays?
Because you need to see.
I need to see and understand really what's going on underneath. If I just, let's say I went to a cardiologist because I had a ton of blockage in an artery and was causing me chest pain, perhaps high blood pressure, and potentially a heart attack. Would I just want them to start opening me up and just, look around and clear something out?
Yeah.
Or do I want to do the specific scans and diagnostic tests that tell them exactly what to do?
Sounds like a no-brainer.
Why would I treat the nervous system any less than the best? And the nervous system is what powers every other system, so why would you just want to go and get poked and prodded by somebody without knowing really what's going on in there?
So why exactly do you look at the x-rays though, to understand how the nervous system is working for someone?
That's another great question. The way the joints and the vertebrae are aligned have a lot to do with how much space there is for a nerve to exit the spine that sends signals from the brain through the spinal cord to the organs, the cells, the tissues, the muscles, and all the functions of the body. So if I see misalignment, if I see that there's compression in an area that really should not be there, that's an indication that that person needs care. Now, if it's been like that for 10, 15, 20, 30 years, wouldn't it be important for me to see it and to know how to take care of it better and how to help those nerves heal, get pressure off those nerves? So it's not just because I like to do a lot of imaging and I like to, make the day longer for a person coming to our office. I do what's necessary to be able to understand how to take care of you better. And of course there's some instances where I cannot take an x-ray. Pregnancy is one of them. Usually kids under 13 or so, I don't typically x-ray, depending on what's going on with them though. It's all very case specific. But the other thing is, like, let's just say I've had several people that have had fused vertebrae. So they were born with a fusion. What that means is two bones were connected at birth. And this has happened in multiple areas of the spine, multiple times in my 15 years of practice. If I'm trying to move something because I feel like it's stuck, yet I didn't look at an x-ray, but I'm feeling it's stuck, and I'm saying, well, let me just make that move. Well, you cannot make a blocked vertebrae move individually if it's blocked together as one. Wouldn't it be good for me to know that that's there? What if somebody has an extra rib, or has a fused rib, or asymmetrical joint in the lumbars like I do? You can adjust one side, but the other side does not move. And that's just the way I was made. So why would you not want to see that? And that's just, I'm sorry, I get a little excited.
Yes, you should.
But x-ray is so vital and valuable, the tool. If we have that tool, why can't we use it? Why shouldn't we use it to the best of our ability?
Is it helpful to kind of see that phase of degeneration?
Yeah.
And
it helps me understand how the spine has been wearing over time. If there's excess wear and tear, or any wear and tear that shouldn't be there, I'd want to know that too, to know how best to take care of that person. So that's a great question. I love talking X-ray all day long.
So we have another question.
Oh, that's it.
This is from Pamela from Vestavia, and she's interested in coming in, but she's never been adjusted before. Does it hurt?
That's my favorite. When you've never been anywhere else, come to me first, please, because then I can explain things from the beginning the right way. I don't have to retrain you. So that's a great question. Does it hurt? I can't speak for everybody because look, my first adjustment ever in 1998, it didn't really hurt. It was just a little surprising. Probably I didn't know what to expect, and that's probably most people's experience. They're just a little nervous about what to expect. I think my, if I could say my strength is explaining and preparing people for what I'm going to do. So if you're prepared for it, it's less surprising, and you tighten up less, and usually can relax better. And no, it doesn't hurt. Sometimes if something has been stuck for 25 or 30 years in the wrong position, to try to help it maneuver in the right way, yeah, it's a little bit difficult, kind of like a workout. Say you didn't ever do a squat before, and then you did 25 squats. Don't you think maybe it would be an issue?
My
You'd be sore.
hurts already
Just
just
thinking
thinking about it.
Let's do 10 squats after this podcast.
No, you can. We'll watch. We'll
I'll
videotape.
do your 10.
Roll it,
I'll do
right?
40. How about that? I do it all day long though when I see
Yeah,
patients.
you do.
I'm
It's
squatting
like-
the whole day.
Lunges all day long.
Yeah, my legs are giant. If you've never seen me before, like, I'm impressive. If you have seen me before, just ignore what I just said. All right, another question. Fire away.
Okay.
Hunter, you got one?
Yes. So one person asked, will you show me ways of preventing what you're actually treating?
Okay, that's another awesome question. I like the wording because I'm not treating. So they said, can you help me learn ways of avoiding what you're treating or supporting what you're treating? I don't treat. And I know that's a kind of a, sarcastic way of saying things. Or maybe I'm nitpicking a little bit, but what the verbiage there, the wording of treat is, I am diagnosing and I am rendering some sort of a treatment to a disease or condition. And in my office, I find what is impairing your body from doing that itself. So I'm rendering care. I'm giving care to your body, and your body does the treatment on its own. Whatever it needs to do, it starts to balance better. So what can you do at home to either prevent it from returning or to help it strengthen to get better, those kind of things? There's a lot of different things, and it kind of depends on the person, but the most typical needed support is going to be the neck roll. We talk about that usually on the first day here after the adjustment. Second day, let's be specific. After the first adjustment, I talk to people about how to do the neck roll. And that is really crucial in order to help lay on a little roll that helps to restore the curve of the neck, because it is crucial for you to have a curve in your neck, the proper direction. And then also some strengthening and stretches for, let's say, the core muscles of the low back, maybe stretching the hips and the low back. And then doorway stretches. Those are the ones where you can kind of help stretch your upper back and shoulders so they don't keep hunching forward, due to most of us like sitting at a computer or looking at a phone all day. So, I mean, there are other things too. I don't know specifically what the person's dealing with that is specific to the person. So typically after an adjustment, I'll say, hey, this is what I'm noticing today. You could do this at home a little bit more.
Which that also brings us to another question.
Yeah.
Do you adjust people with different issues the exact same way?
That's another great. I don't necessarily adjust anybody the same way, although it may look similar when you're seeing me go from room to room adjusting. Everybody has a little bit of different an issue, and so that's why I study X-rays so intently before I start adjusting somebody, and I get to know them very well internally before they really come face to face with me that much. But like, to understand how to take care of somebody is really important, and then once we render some care, I tailor the adjustment to the person, not to a condition, not to an age or a size. It's all about what that person is dealing with and what I've found with them. So while it may look similar, there's going to be a different touch, a different feel, a different strength, and a different focus, yet the underlying focus is going to be freeing up those nerves in the spinal cord to send the right signals in the appropriate way and let the body heal. So the intent is always the same. However, the adjustment and application is a little bit different from person to person.
Okay, good to know.
Long answer, short question.
Well, here's another short question. This is
Prepared for a long answer.
well, this is from Camden, from Birmingham. She wants to know, will I be required to remove my clothing at my adjustment?
Oh my goodness. What are you? So there are offices that gown patients before every adjustment. So I get where that comes from. That's a different technique, depending on the person. So we've actually made different, we used to have to do that on the first visit where they would come and we'd do some scans and EMG and things like that where we'd have to be able to contact the skin. However, we've kind of streamlined a lot of the testing we do to be able to not have to do that, because I think it's more comfortable when you don't have to get into a gown or disrobe in some way. However, if you have a lot of jewelry or earrings that might be blocking the first day x-rays, the visible things that I need to see, we might ask you to take those out. But typically there's no disrobing of any kind anymore in our office, no.
So not in the rooms, not before adjustments.
Not during adjustments, not after adjustments. I mean, I don't know what you do at home, but in my office, no. No disrobing.
Okay, well.
Thank you for the humor on that one.
Yes.
Although,
thank you,
that might be
Camden.
a serious concern, so I appreciate that question.
And also, you were just, this is a question I'd really like you to explore. What about, you were talking about techniques, different places, different techniques. Can you just tell me a little bit about your technique that you practice?
And I would love to take credit, but I cannot take credit. I've learned from a lot of people over the years. And I studied at Palmer College of Chiropractic in Iowa, which was where the first chiropractic adjustment was performed, all the way back in 1895. And the first school, Palmer School of Chiropractic, started in 1897 from the founders of chiropractic, D.D. Palmer, and then eventually his son took over, B.J. Palmer, and then eventually his son took over, David Palmer, and then his daughter is currently still on the board, Vicki Palmer, as far as I remember. Anyway, so it's been 123 years since that school was started, and they've come up with what they call the Palmer package, which is 4 distinct techniques that they teach. And so I do a lot of the Palmer package, which is some of the hands-on adjusting you might be used to seeing if you've ever seen an adjustment or felt an adjustment. Some of the moves that I do are Palmer. Some of them are actually using a drop piece in the table, so the table drops away a little bit and allows me to set a joint, a hip, shoulder, things like that with less force. So that's called Thompson drop technique.
So that's what that loud noise is.
Yes, the loud noise. Yeah, the metal hitting metal of the drop. It's not a person being slammed around in the back. Then I also use an arthrostim, which is an adjusting instrument that's not a clicker. It's more heavy duty and powerful in that it's going to help us correct curves and change the receptors around the joints to make new alignment happen. So it's really communicating with deeper down structures that I like to use. And there's also wedges. You may have seen the wedges in the office. They look like little triangles. Sometimes I set them under hips. And that's called SOTE, sacro-occipital technique. And I do that with several people as well. And there's a few other things that I sort of have melded over the years that I don't think have names, but sort of call it the Lee technique. Because I think every chiropractor does that, blends a lot of things they've found over the years that work for people. And they've learned from patients. I feel like I've learned 15 years, I've learned more from patients than any teachers that I ever learned from in school. So, so I do feel blessed in that way. But Palmer package is the main technique, I guess, toolbox that I use, along with the arthrostim and the SOT blocks.
Okay.
So do you adjust just the back, or do you adjust other body parts?
Good question. Typically, I think the most important thing is the spine, because that's where the plethora of nerves originate in the spinal cord, and they come off the spinal cord through the spinal joints, the spine. Sometimes I will, adjust an extremity like an ankle or a shoulder or a wrist, something like that, and that actually has become more often than sometimes, because people need it. If you think about what we do all day on a computer, most of us, the wrists take a beating, the elbows take a beating, the shoulders take a beating. Play tennis, play volleyball, play baseball, play any number of sports. They're almost all one-sided. We have a lot of horseback riders. I mean, that's a lot of hunching forward and a lot of compression to the spine. So really, I mean, there's a lot of joints in the body and a lot of them need attention. So
We
it doesn't take
scroll
long.
our phone with one hand, so you know, that's.
Who's we? Yeah, just kidding. I don't have a phone. Yeah, right. Actually, we're videotaping today's podcast episode
On your
my phone. So if you want to see us live, not live, if you want to see a video of what we're doing, check out our YouTube, which is Dr. Lee TV, Greystone Chiropractic Birmingham, and probably it'll be on our Facebook too, Greystone Chiropractic Birmingham. Next question, anybody?
So I have a question. What about a brace to
Ooh,
help
yeah.
hold the adjustment?
I did an Instagram live today about that, the
Oh.
brace. So the brace is something that people might see on ads on Facebook or on I don't know where, and it's sort of like a strap that holds your shoulders back.
I get advertised them all the
Yeah.
time.
I wonder what they're trying to tell you, Teresa.
I'm interested in posture correction.
Yeah, because we talk about posture a lot, so it must be coming up on your focus like this
They're-
all the time. So what do I say? I say, don't wear the posture brace. Why do I say that? Any guesses? Or I just blat the answer out.
Your
Because it-
muscles get weak.
It makes you lazy, your body.
It makes your body depend on it. Imagine if you wore like a cast on your arm after you break it. You know, give it 6 weeks to heal, and then look at right arm versus left arm. Which one looks healthier and stronger? It's not the one that's been braced or cast, right?
Yeah.
So when you have a brace on there, it's actually causing the muscles to depend on the brace and not use themselves. So they weaken and they depend on it, and then they just get further in trouble. So I say use the muscles and actually use it like a stretchy band, that kind of thing, to strengthen those back muscles. Get some active care into your body, and that will make a change better than the passive like strap thing that you would wear. It may look good, but it doesn't help you functionally. Great question.
I've also, I don't know if you've seen this, but I've been also getting advertised that there's like a posture
Zapper.
thing, like yeah, it's like almost like tells
Okay,
you,
let's go back almost 20 years. Lee had this idea.
oh
back,
wow.
Yeah, I don't know why I'm calling myself in the third person this time, but I get squirrely by about 2:07 p.m.
So they stole your idea.
They stole my idea. I've been talking about it for 15 years, and what it was in my head, it was a buzzer.
Medieval
It's
device.
strapped or tape or tattoo or whatever to the back of the lower part of your neck, like where it meets the upper back. And as soon as you go forward, it zaps you with a little, just a little shock, a little wake up, hey, get back to the right position. And lo and behold, there's an app, because I didn't know what an app was back then. There was no such thing as a cell phone, really, like it is now. I mean, it just wasn't smartphone. So these smartphones now have apps, and you can strap this thing to your lower neck, and every time you go forward and slouch, it zaps you little vibration. The problem with most people is they're all really far forward all the time. So where are they setting their neutral? They're
Yeah, I
already
think a lot of
forward,
people
so
don't
their
know
neutral's forward.
Know
So
where
then
the neutral is.
the only thing that would cause it to buzz is if they go forward, more forward than forward. So if I'm already 2 inches forward, it's going to take another inch, which is like 30 pounds of head weight. So I do think they're probably helpful, but you've got to have somebody working with you to be correcting that neck curve and do what you need to do to get better in the first place, and then do that thing, just to kind of make sure you don't fall back into old patterns. So.
And in case that app is listening, Dr. Lee would like his
Well,
royalties.
there's like 7 of them now, 10
Oh,
or
wow.
15. They all owe me a lot of money.
We all want, we all want it. We all want that better posture.
I thought you maybe we all want the money from the app.
As well as your money.
We'll take it. Just, Venmo me. It's Lee Goldenberg.
So,
What else we got today?
the last thing we're kind of really wanted to talk about today is insurance. We get this question a lot, like, will insurance cover my care?
What is insurance?
I
I mean, legitimately, what is it?
it's something we put money into that
I
hopefully
mean, but like, what's it for?
when we get sick.
It's
when we
for
get
like
something happens.
catastrophic. It's
Yeah.
for emergencies. You don't use your house insurance to like maintain, like to paint, to repair gutters, to keep water out of the house, to do the things that you need to do to maintain. It's not like your lawnmower, guy, or your lawn maintenance person. It's if something breaks or some, you know, fire happens or a tree falls on your house. That's what the insurance comes to take care of. Health insurance is the same way. Like, it's there just in case some major thing happens. So in our office, of course, like, we want you to be able to utilize some insurance if you have those benefits, but it's really just to get you out of a ditch. You need to support yourself and to take care of yourself. So chiropractic care is not really meant to fix brokenness. It's meant to help you maximize life and stay well. Once you get well, my job is to help you stay well.
And thrive.
That's where we really excel. So insurance necessarily doesn't cover that. You know, you might get 12 adjustments in a year. Does that really make a dent in correction? I mean, think about this. If you had braces, how long would you have to wear them? Like your teeth, I mean.
Yeah, I don't know.
Orthodontists would say
4
like
years?
1.5 to 3 or 4 years.
Wow.
Some people longer. But like, let's just say average 2 to 3 years. I mean, let's just say you took the braces off in a month because insurance said, well, you only get a month worth of braces. Like, aren't you gonna pay for the rest to get the teeth straightened? Or are you just gonna take the month? It's gonna go back if you to where it was, if you take those braces off so early. So the key is to not just wait for insurance to pay for you to take care of you, is to invest in your health. Same way you invest in your workouts, in your healthy foods, at, you know, wherever you shop for healthy food, organic vegetables, such and such and such. So insurance is definitely not here for wellness. It's here for get me out of the ditch. So I do not like when people are just depending on that to pay for everything to keep them well. So what exactly does somebody, like when they first come in for an adjustment, what do they need to know about insurance? Well, there's a deductible, right? A deductible is basically the amount that you have to pay out of pocket before the insurance company gives you $1 toward your care in any office. So that could be urgent care, that could be here. Let's say you have a $500 deductible.
In the meantime, you're using up your visits.
You're using the adjustments too. So let's say they have a $500 deductible and 20 adjustments over a year. The $500 deductible has to be paid out of pocket. But the unfortunate thing about what's been happening the last few years is that they're using the adjustments while you're paying down the deductible. So if you came for an adjustment and it's going toward your deductible, let's say 10 adjustments pays for your deductible, then you've just lost 10 adjustments and you had to pay your deductible out of pocket. So you have like 10 left.
Yeah.
For the rest of the whole year.
By the time you hit your deductible.
So the best thing I can recommend is to look into an actual care plan that's a wellness care plan. That's something I would recommend once I looked at your x-rays and your history and your findings. I'm going to come up with a recommendation looking out a year from now. Let's look at the next year. Let's look at what will it take to help you not only just get well, but to stay well over the next year. How many adjustments is that going to probably entail? What does it cost? And let's find a financial way to help get you on a care plan, like a monthly or prepay or something that's going to help you afford it over time. And yes, use some of your insurance, but mostly you're going to have to invest on your own. So that's what we come up with in our office, and usually on our x-ray review, when we go over the x-rays Monday nights, we discuss that with new people, and we tell them exactly what it takes to get well and stay well.
So would you recommend a different wellness care plan per person, or are they all the same?
Yeah, they're all a little different. Usually it's based on the condition of the spine that I've looked at, and I kind of grade it on a scale of how, I hate the word messed up, but how much use and wear and tear has gone into the spine over time. It's not how old a person is, it's how worn is it because it's been misaligned for how long it's been misaligned. So let's just say I've never been adjusted and I'm 25 years old. Well, wow, that's 25 years of buildup probably since the first day I was born, you know? That's 25 years. What if I'm 50 or 60 and I've never been adjusted or cared for my spine? Well, we are in for some work. So I'm gonna say, you're gonna be in here and you're gonna be getting some regular care, multiple adjustments for, you know, several weeks until we get to the point where we're holding to once a week or once every other week. Could be 6 or 8 months before that happens. But yeah, everybody has a different plan. I have some people that come in every 2 weeks. I have some people that come in once a week, like myself. I have some people that are in 2 to 3 times a week in the very early phases to repair the damage that's set in. And so we come up with an affordable way to handle that for everybody. So lots of ways to look at it. So I feel like we've answered a ton of questions. Any more thoughts, stories, anecdotes, poems, or anything from you guys?
I mean, I really do like how you say, like, gotta invest in your health now. It's
Invest.
like, what they
Invest
say,
now or pay later.
pay later,
is
yeah.
what-
Pay with sickness later or invest in your health now.
Yeah, I know that's a bit of a trite statement, but it's true.
It's true.
You don't take care of it now, it's gonna be broken later.
Mhm.
That's the same with your house, same with your car. I mean, we have some pristine cars out there. Who's not taking care of those, right? Everybody's taking care of them.
Yes.
That goes for your pets, that goes for you and your family, and everyone you want to be well.
I love the analogy with the house too, with the health, with your house insurance, because like I want to decorate my house. You know, I want my house to be like beautiful, to like for it to be a temple, to be to thrive. Like same with my body. You know.
Yeah. And what's the most important thing that's going to be with you for the rest of your life? Hopefully, it's your body.
Yes.
It's your health. You know, it's the last thing you can take with you. Or can you?
It's like we've got some transcendental.
Getting out there. It's getting late, so I'm going to say thank you. Any other words from you guys? I appreciate you guys being here as always. I love chatting with the team at Greystone Chiropractic. We have a lot of fun doing this. I'm Dr. Lee.
I'm Teresa.
I'm Jessie.
And I'm Hunter.
And we say adieu.
We need,
That was good, guys.
we need that transition music though. We were talking about
It'll-
no,
Oh,
like,
between
yeah, we were talking about, you know, you're gonna make a little riff or something.
between what?
Yeah, like between